What if the key to getting your AgeTech pilot approved wasn't just about your tech, but how you prove its value? Today, I sat down with a wound care innovation founder to discuss how do you truly create something that hospital care about, in which metrics, and how to structure a pilot for them to say yes. And the surprising way hospital partnership is created. And the surprising way trust is built for partnership in long-term care. If you're waiting to land your first or next pilot with hospitals or physician groups, this is the conversation you need to listen to.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Rombach, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Before we dive into today's conversation, I want to pause for a moment and talk directly to the amazing innovators and founders in the room, especially if you're preparing for a fundraising or aim to land a pivotal partnership this year. Your pitch isn't just a story, it is a strategy. And if you're still guessing what investors or decision makers want to hear, you're already behind. That's exactly why we built Pitch to Yes. We don't critique your pitch, we co-create it with you, and for free. You will walk away with a persuasion scorecard and a rewritten pitch that's ready to grab attention and take into action. Grab your seat at pitchtoyes.com. Now let's dive into today's conversation. Whether you are making strategic decision, navigating the uncertainty of your next best move, or looking for a smarter way to grow, this episode offers insight worth pausing for. Welcome to another episode at Point Click Care Summit. Today we have amazing Amy here with us. We are talking about one of the things I feel like people just never really know much about, and we know it exists, especially us in practitioners, is wounds. And wound care is somehow, not everyone even trained on wounds.
Nope.
I'm in surgery, so that's number one is you deal with surgical wounds. Mm-hmm. And of course, we got dinged if the patient comes back with
surgical site infections. Yes.
And then you have a lot more of what if a patient fall? And especially the elderly, so it doesn't matter if you're in a hospital, you're an outpatient, you're a long-term facility, their skin texture already is poor. To really taking care of them with different solutions, or you actually have to sew them back up and all different, even I pick up from all the plastic surgeon people, right? It's amazing how wound is such a detrimental thing.
It's such a detrimental thing, but people often don't think of it as a primary thing, right? Like you're in a facility for, I don't know, maybe you fell at home and have a hip fracture, right? So you're there for the ORIF, you come in and people are like only focused on that hip in rehab and physical therapy and OT, but don't think about the whole body as your major organ, right? Your skin, are you sedentary? Are you moving? How are you repositioning? How are you hydrating? How is nutrition? What are your plans to go home? Almost like the hidden problem that no one wants to talk about, even there is a large prevalence of wounds, right? And you don't want those in-house acquired wounds as well, right?
Right, and it taps also into infectious disease. If you facilities, you always have these silent people just walks around and then checking on you. And therefore, doesn't matter if people have open wound versus pressure wound. Early stage pressure wounds are these tough spots that we just have pressure because people lay on there for a long time, don't move. And that's even critical for all the nursing staff, MAs, assistants to help them to move. And we have a different solutions, technologies coming out of the pipeline, different foam, mattresses, even gels to heal up these wounds in a faster way. Now, it's a complicated thing. I think skin is the largest organ in human body, but we see it as, oh, I have a little dry skin, asthma, I'll just put lotion on it. It's more of how do we not recognize our health into this multidimensional way, which I say all the time. Yeah. Human health is mind, body, soul connection, and building a company is also a mind, body, soul connection of different critical points. So how come we are aware, but we're not intentional enough about doing so?
Yeah, I know it's often like I think about when it goes back to my foundation in education, like nursing, 25 plus years ago, what was I taught then and how much has changed in those 25 years from the way to you assess a patient's body, the head to toe nursing assessment, even to the documentation. When I was in nursing school, you learned paper charting, right? Like my sister graduated a few years ago. She's like, what is paper charting? Everything's electronic, right? So you have to think of that progression of healthcare just as rapidly changing and evolving. But how can you partner with point-click care, providers, and bring it to one central location? So it's truly an interdisciplinary team that's looking at the patient holistically, right? Maybe their wound's not healing, but they're not eating, right? Maybe it's a comfort food that a family member hears the recipe and brings it in, or you work with the kitchen or dietary. Maybe it's they're depressed and don't want to get out of bed, so they get a pressure injury. Maybe it's I had that hip fracture, now it's infected, and now I have to go back to the hospital, right? Like people have to think of it holistically, as it's not just that little hole in your body, it's your whole body that you're treating when you're looking at wound care specifically.
Exactly. And then wound, when you don't taking care of, that can go into sepsis, right? Very quickly. Yeah. And then we're also seeing patients who have dementia, these mental health issues. They don't move in bed. They don't remember. They can't understand. They don't get out of bed. And especially long-term care, if you somehow didn't really rapidly checking on those people, you think they're just sleeping and now they're not eating. Now it becomes a really rapidly getting to a point that pressure ulcer can create. And therefore, it's a integration system. When we're looking at the basic foundation of assessment and what do we do from a foundational nursing level all the way to a clinician level and the system at large, and getting family involved, just say, oh, how's our moms, grandparents are doing? Some people don't really know the right questions to ask. And even you can present them with all the information, they can only dissect so much as they know. Without some of my friends, I would tell them, stop ChatGPTing.
Yes. And stop Dr. Google. Stop Dr. Google. No, but it goes back to the foundation, right? Just like you said, it's how do I get the family involved? How do I get the patient involved? How do I get the nurse and the provider involved, right? It's that true approach. And I think technology is really starting to see how that communication can come together, right? Not every person is a wound care expert in healthcare, right? Like you learn minimum, if I would call it that, in nursing school, and I'm sure in medical school as well, right? But how do you take the expertise that I have, that I took the time to get the certification in wound care, and share it to everyone? How do I work with that patient? How do I educate that patient? How do I educate that family? And how do I work with the provider that may not be the expert, and you may be the only provider in that rural area, and you're the ID doc that also happens to do wounds, right? Like, how do you collaborate and work together? And I really think technology is bringing that together, right? Now you can take a picture of that wound. It does the trace, it does the length, the width, the depth. Very soon we'll have smart tissue coming out, so it's going to tell you the tissue type as well, right? Like that's in beta coming out very soon. But now you have, at that point of care, when you're starting to do documentation, it's guiding you like, oh, this has changed. Oh, I need to call the provider and be like, I think that there's an infection. I don't want this resident to go to the hospital. How can we intervene sooner? Or how can you even gamify it for that patient of, you were at 5% closure last week, can we get to 10% closure this week? By, involving that whole team, technology is really bringing us together, I think. And wound care is like an underserved space, right, in the technology, but just in healthcare as general, it's thought as an after effect, not the primary diagnosis many times.
Right. And even just for surgical wound, for example, if people come back and they have a depth, then I wanted to put in the wound vac. And at the time, old school, right? We have a little paper rulers and looking for tracking size, how big I want to cut it. And now I have to write out my whole order for wound care nurses to do at home or in the hospital or long-term facility. And for a solution like yours, that can be, we'll dive into it more. What I'm presuming is digitally scanning, predicting, measurement already there. So then even I'm not there physically looking at the wound.
Virtually, you're there supporting.
Virtually, exactly, supporting. And nowadays, some like even Epic, you can really quickly take a picture and attach to a note. Now I can see, the wound bed looks good. It doesn't have to come back where I need to wash it out, where I need to cut some of the tissue. Nurses can just do the next level of wound vac, right? And from a remote care perspective, we always want to know that not create too much alert, right?
Yes, because alert fatigue is a very real thing.
When we think of innovation in healthcare, wound care isn't usually the first thing that comes to mind. Yet it can determine whether a patient recovers smoothly or ends up back in the hospital. In my conversation with Amy, we dug into why wound care is an invisible problem in patient care, the critical role technology now plays in monitoring and healing, and how partnerships like Swift Medical with point-click care can accelerate adoption by meeting providers where they already work. From AI-driven imaging to smart tissue technology, we explored how the right tools, paired with the patient and family engagement, can turn a silent risk into a measurable success story. Now, before we jump into the second half of today's conversation, let's take a quick pause to share something that could be perfect next step for some of you listening. If you're a founder with a minimum viable product and you're ready to present in front of active investors and decision makers from health systems and organizations, apply to be a contestant at healthtechshowdown.com. Just send us a short explanation under 200 words about your solution and why you want to pitch in front of investors who already back companies in your space and buyers who are actively searching for what you built. Each time we run these competitions, we spotlight one key domain, such as mental health, women's health, digital tech, remote care, sleep medicine, AgeTech, caregiving, diagnostic, biotech, and health education. We don't just put you in front of investors, we actually help you to make sure you're prepared. All right, let's get back to the second half of our show. Correct. And it's also fatigue for us physicians to say, if you worry about it, or patient over worry, oh, my thing drained. I'm like, it looks fine to me, so let it drain. Like,
exactly.
But they don't know that. So they got super scared. They go into urgent care. Now they're costing them to wait, to travel, and to have the extra copay that a remote nursing staff, a home care staff would have taken care of these things.
I get it. And like, we've been a partner with Point Click Care for about 9 years, but Swift Medical, we serve other markets as well. So the home health, traveling providers groups, we have a lot of clinical trials and research. But when you start looking at it as how do we have that whole ecosystem, and it's not just that single point in time, but how can I follow that wound through that entire journey, right? Yes. So you have the patient that, I don't know, was an MBA in the hospital, images are started there, you have that hole, and then they go to an AgeTech for a rehab, right? Or they go to a sniff for a rehab, right? Then they go to home health. Right now it's so siloed. We're trying to bridge those gaps that you can follow that journey of that wound wherever it goes. And then you have the provider that comes in after the fact, right? So it's looking at it, it's taking what we know. I think that we've learned so much in healthcare is how do you follow that journey? Just like we were listening in the opening session, is like, how do you have that patient? He was talking about in the opening session today, they're in Texas, right? When you have shelters and you're displacing people because of hurricanes, right? The last thing you think of is a medical record. But what happens if I'm bringing grandma in? I don't know what med she's on. I don't know what this is on. How do I have that record follow that patient, irregardless of where their physical or virtual space is, right? And I think that's what we're really trying to do in wound care specifically is empower the patient and empower the providers and the clinicians that are serving those patients.
Right. You guys are playing into that interoperability part where patients are, doesn't matter where's that first point, right? If they come from home, they fall and they broke a hip, now they have surgery, and that wound needed to be taken care of. If they're actually good nutrition, they do see a dietitian, stick to a plan if they do stick to a plan. And then when they are discharged, someone needed to watch that wound. Even it's healing, someone still have to put an eye on. And when the dehiscence start, means skin start opening up for at that moment, then how quickly we can interject for the woundness to come in instead of the regular visiting nurse. So then we can have you guys a solution to predict that, and then really quickly to have a close feedback loop to whichever EHR system that the clinician are using, or having a phone call or whatever that not. And then you guys have your own tracking system as they move into different phases, which we mentioned. If they happen to go to SNF, a long-term care, or they're going back to home, now we're providing home care. Tell us a little bit more about exactly what the technology is using now, and also how many different facilities or things you guys are covering so we can celebrate those wins.
So actually this year is our 10th year. Literally live on LinkedIn today was our big blog post about our 10 years. So it's super exciting. So that's a big celebration. But just looking at the evolution of AI and where it's come, right? Like we at Swift are very methodical when we look at our research and our evidence and generating. So there's so many people that, I mean, in a weekend you can build an app, right? Like it's my 10-year-old can look what I built, mom, right? But how do I take that evidence and that deep machine learning and apply it in a way that clinicians don't even really realize that they're using AI technology? Like we have more than 30 million wound assessments just on wounds, calibrated, very, structured in the documentation. We have over 62 million evaluations in general. That's including like whole body, total skin assessments, Braden scores, right? When you look at that, more than, I think we're about 40 peer-reviewed journal publications, right? Tons of posters. But looking at it from a real true evidence-based clinical aspect versus what's the latest and greatest tech that I can build in a weekend, and merging those two together, right? Talked about a lot of, but at this conference, they've talked a lot about how do you adopt technology. You have new grads, you have seasoned nurses that have been around, providers, clinicians that have been around for a long time. Whatever technology you're putting in their hands, they have to trust that technology, right? And if you can't get someone to trust your technology, you're going to have a poor adoption rate, right? So by partnering with Point Click Care and other providers and vendors and EMR spaces, it's how do you take a trusted technology that they've used for a long time, put yourself into that technology, right? And then now working on the other side, the predictive side, right? So like part of why we partner with Point Click Care is the content management. We're generating the evidence, we're looking at the evidence. So now when you're taking that picture and it detects something different, it's going to say, here's a few interventions maybe for the clinician that you can do. Let's alert the provider, maybe you should change a dressing, right? So it's taking that now you're trusting technology, AI technology, you're have the evidence to back it. You have those clinical pathways or clinical decision support pathways, right? So it's just like the steps that we've taken over the last 10 years. It's super exciting to celebrate that, but also to see that people are now warming up to AI technology, right? Like it's here to stay. It's not a fad. It's not going away. Like we're trusting the technology and we're going to move forward with it. So
Yeah, I think the lesson learned there is you partner with other people who already have a trustability.
Correct.
Or is established enough that you are not building from scratch. Therefore, PCC is one of those. And then all technology companies that start to expand, it's about finding the partner that can be codependent. And so you can do more things together because not everyone can solve all the problems. And when you have this niche field with a subcategory of population you can serve, then figure out who else is already in that space that can quickly help you to interface your solution to the existing population that they already work with, and make your life is just so much easier. And trust also for us is we say you build trust through social capital. And that means the story that you're telling, the brand that you're establishing, the people who are telling these stories need to be have the same alignment. And then they cannot be having different stories. Then you become very confused about what you guys are actually do in the space. And then ultimately is having such a high curiosity for the organization that you're working with. That's how you actually truly sell, is you're supporting people where they are. You paint a picture, not just, this is what I do really well, is that I see
the collaboration,
this concern that you have, and then we can interject this way. And then even though we have a set workflow, and then we can adapt to the things that make sense for you, right? So it's that true collaboration. And at the end of the day, you do need the people who are open-minded, right? And if they're that resistant, it's okay to move on.
Yeah, exactly. And it's, I mean, obviously in our 10 years, trial and error, we've learned a lot and we've grown immensely. You have to be open to embrace the change, and you have to find the people within your organization that are going to help you embrace that change.
What I love about this part of our conversation is how it shifts from talking about wounds as an overlooked risk to the bigger picture of continuation of care and trust in technology. Amy shared how Swift Medical has spent a decade building a clinical validated AI platform with over 30 million wound assessment, making it possible to follow a wound from hospital to rehab to home without losing critical information along the way. The real key, pairing your innovation with partners who are already trusted in your marketplace. So you're not climbing the adoption hill alone. As founders, that means crafting a brand story your partners can carry forward with alignment and clarity. Because when everyone is telling the same story, you multiply trust and speed up results. Now, I want to hear from you before we go to the rest of the episode. Tell us in a comment below wherever you're listening to this, watching it, and post it on LinkedIn and tag me, Sabrina Runbeck, running backwards with an E. When have you seen a hidden problem of patient care and you created a product and service behind that, or add to what you already be able to create?
But also challenge you to how do you challenge yourself to take the next step to think outside the box, right? Like 5 years ago, I would never thought, well, clinical decision support, right? Like, no, like as my scope of practice with my nursing license, how do I do this? Now it's like, okay, we're already doing this in other segments, right? Like, GI/GU issues, like take a bladder scanner, it tells me what to do, right? Like, but how do I take that and apply it in healthcare, but also how do you apply it within your organization, right? You have to challenge your organization, challenge the people that you work with to think outside the box sometimes, right? Right. Just to continue to move forward.
Yeah. So as you guys have 10 years of fun, where we're going with this, what's the next year's goal? Is it more
Next year's goal is
Yeah.
continue to grow, really just launching some new innovative features, some things that, when you take the picture, it may tell you the bacterial growth in there, the thermography. So not only do you have length, width, depth, now you have tissue type, and now we can tell you in real time it's infected or if it's heat, if it's hot there, evidence of infection, and just really continuing to break the barriers in wound care, right? Like 10 years ago, people didn't trust taking a picture with measurements, like, oh no, I need my ruler, right? So like we've broken that barrier. We're taking this barrier, breaking that, but also value-based is the way that we're going. So how do we partner with our clients and our partners and understanding the value base and what does value in wound care mean to the patient, mean to the payer, mean to the provider, right? So, just continue to grow those stair steps within the organization.
Perfect. So what would it be helpful for other people? Is it more funding toward those projects versus having the key conversation with the right payers, right collaborator to refine what is it that you guys need to build?
I think, first of all, you have to understand value-based and you have to understand where it's going to go and how do you fit within that value-based ecosystem, right? Keeping people out of the hospital is a big one, right? So if surgical site infection, I can detect that it's infected earlier. We can intervene, whether you're in your home, whether you're in a nursing home or a skilled nursing facility or an assisted living. I'm intervening. So now I'm keeping you out of the hospital. I'm putting on, I'm removing that undue burden of transporting them back, the undue burden for that patient in the setting, but I'm also saving the provider and the payer money as well. You have to have your value to understand the data. Okay, you have a digital wound care measurement tool, but we have evidence that if you use our technology with the 90T approach, you're going to heal your wounds 35% faster. So now if you're healing wounds 35% faster, I'm saving this amount with the payer. I'm also now increasing your capacity to admit more patients, right? Because you're healing them faster, and we're also helping you save money on the supply and the cost, right? So looking at that ecosystem there, and then identifying with the companies that you already work with, what you have in common. Is it a certain payer? Is it a provider? Is it the ACO? And approach it from that. And you have to have the data to back it, and you have to have the collaboration with the providers as well going into it.
So that's where you guys are focusing on, is identifying a couple of these systems, and then who are their payers, what are the communication between that they will consider, let's say surgical site wound reduction or early detection of pressure wounds,
Right.
or whatever that is their main focus, and then creating a pilot around it. So then you can actually say, okay, we're developing an early detection of an infectious tool. How would this fit the mode of what we call market research, right? And of specific application. And then it makes sense to spend more money, resources to build this out.
Correct.
Because you have a partner that have a clear plan to implement that pilot.
Yep. Yeah, but if you don't understand the foundational basics of it, you can't get to that part, right? So value-based is, it's fun to navigate, challenging to navigate at times, I'll put it that way. But ultimately it's I'm getting that patient back to seeing the value of the care that I'm providing you, right? Like, let's forget about like the stuff on the edges and the fringe. Like, let's get back to how can I drive and deliver you the best value care in the most cost efficient and cost effective way, right?
Yeah. Are you guys already in conversation with the certain hospitals about those things right now?
Yeah, and lots of exciting things to come this year.
Yay!
Lots of exciting things to come, so.
Yeah, I can't wait for all those fun stuff coming out of the pipeline. As we wrap up, I always love to ask a fun question.
Sure.
So I'm going to give you a magic wand.
Okay.
The magic wand grants you 3 wishes.
Okay.
To be able to push forward all the initiative that you guys like to do as Swift. And what would you use the magic wand for?
What would I use the magic wand for? One is just how to deliver education to the patients, right? We've heard a lot about, clinicians and documentation, but if you don't have patient buy-in, and if the patient doesn't understand, or that patient caregiver doesn't understand how to heal that wound, It's your biggest barrier, right?
Right.
So how can I use my magic wand to through the technology, through communication, educate patients on wound care and prevention and healing, things along those lines. So that's one I think that I would do. Other one is everyone always wants to move faster, right? Like everyone always wants to move faster. Can I take, our ideas and make them reality now? That would be my second one. And I think the third one is that how could I make that interoperability go faster in the entire healthcare ecosystem, right?
Yeah, because for you guys, it's like you have your own client journey that you can track on your back end. How are you connected to everybody else's? What are they using in each area? And then when they got a minute, what are they using? And when they go home or they go to long term, are they PCC or something else? And how you are able to capture all those data.
Yeah, and I think just having that magic wand to make it go faster, it's not like that you can't go faster, but there's so many points, right?
Yeah.
Like you just said, outpatient, inpatient, this one uses this one uses this one. It's
even same hospital system, the outpatient physician office is different from inpatient.
Yeah, different
and then
medical
you're
records.
like logging into every different thing. I'm like, whoa, okay. Like you wonder why it's taking us all so long to provide patient care, and then people are waiting around.
Yeah.
Right? Definitely for anybody who's interested in improving wound, getting people are not just already diagnosed disease, but the prevention side of senior care, go talk to Amy. And how can people best find you to have a deeper conversation?
Yeah, you can find me on LinkedIn, Amy Cassata, or you can visit our webpage, swiftmedical.com, and then look at leadership and then find me from there.
Awesome. We so appreciate it for everyone who's watching, whether you're watching this live streaming, YouTube, or any of our podcast syndication. We would love to hear from you. Is wound something that you thought about, where you already have things implemented? What would you want to see more of to solve a specific problem in the patient population you wanted to take care of? Comment below, and also reach out to Amy so we can all have a more meaningful conversation. Until next time.
Today, Amy and I talked about why wound care is one of the healthcare's most underestimated challenge and how evidence-based technology is transforming it into a measurable driver of patient recovery. We also discussed how the AI-powered wound imaging and measurement tool are helping clinicians reduce healing time up to 35% while making continuity of care seamless across hospital, rehab facility, and home health. And this is one of the most important things that hospital will be looking at for what exactly is your solution, for what exactly is the outcome that you can support in order to accept you for a pilot study. Now, here are the 6 key points we discussed. Number 1, wound care is the hidden driver of outcome. Neglected wound can derail recovery, increase readmission, and hurt patient satisfaction. Yet they are rarely treated as the primary concern in most care settings. Number 2, technology can close the continuation gap. Swift Medical's AI-driven image ensures wounds are tracked consistently from hospital to home, preventing complications and unnecessary transfers. Number 3, interoperability wins trust. Their partnership with platforms like Point-Click Care means physicians can adopt new technology without disrupting existing workflow because they're already using Point-Click Care, therefore accelerating uptake and impact. Number 4, value-based care requires proof. With data showing up to 35% faster healing rate, founders can make a stronger case to payers, providers, and investors. That is their competitive edge. Number 5, collaboration beats competition. Scaling happens faster when you work with stakeholders already trusted in your user, instead of trying to replace them. Number 6, think beyond your core product. Founders who integrate education, workflow alignment, and adaptability into their solution creates longer-lasting results. Now tell us, how could strategic partnership accelerate your adoption in facilities you've been struggling to enter? Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.